Yeah. Okay, so am I audible? Please confirm the audibility and visibility. Yeah, so we are waiting for this video from long time, I hope. Let us understand and let us, yeah, thank you so much. Yeah, fine. So let us start the discussion of today's session. So let us understand the medical device rules, chapter wise and rule count. Okay. So as we are preparing for the examination, so there are different counts, different digits here, rules, chapters, and forms. Okay. So there are chapters. 12 chapters are there, and 97 rules are there, and 42 forms are there. So how to remember this for the examination? So there are chances for confusion. I tried to segregate the rules, chapters, and forms, and I tried to reconnect them. So let us understand. Okay. Yeah. Right. So to understand this medical device rules and complete 2017, so we need to make a story. Okay. So the logical story is here. What we will do, how to remember chapters, rules are import, sale, distribution, manufacturing, right, and clinical investigation, all these things. So here first we define. Okay, first we define the bodies and then classify. Okay, so then we classify the medical device, then we manufacture it in India. Okay, then we import it. So this is the sequence, right? And then before selling we test clinically, and label it properly. We have to label properly and sell it legally, so this talks, each and every word talks about chapters. Okay, chapter, first one define, so chapter 1. Okay, so like that we need to make a story. Legally, labs and inspectors ensure compliance. Okay, testing labs and inspectors. Okay, drug inspector, you. Okay, so to ensure the compliance, and if violated, penalties will follow. So penalties will follow. If violated, penalties will follow. And finally, old rules transition into the new MDR 2017. Okay, so this is how the old medical device rules 2017 we can remember the flow. Okay, so let us repeat it again. First we define and classify the medical device. Okay, the classification comes under chapter 2, and then we manufacture it in India and import it, and then before selling we test it clinically and label it properly. So once you test clinically and then you go for labeling properly and sell it. Okay, sell legally. After selling, labs and inspectors ensure the complaints. Once it comes into the market, then labs, testing labs, and then drug inspectors will ensure the compliance. If violated, if something goes wrong, then penalties will follow. Then last, finally, the old rules transition into the new MDR 2017. This is how you have to remember the chapters flow. So let us go into the individual chapters. Okay. Yeah, this is how the flow will be, right? So we can remember the chapters, medical device rules. So the first chapter, preliminary, as we discussed, definition. Okay, preliminary. So in this, there are 3 rules. Okay, 3 rules are present. So don't worry about the rules. Again, I will tell the connection between the one rule to another rule. So first chapter contains 3 rules. So rule 1, short title and commencement, and rule 2 is application. Rule 3 is definition. Okay, so first we given this define. Okay, we will define. Okay, titles, application, and define. This chapter establishes the foundational elements of the medical device rules, including the scope of application and the key definition that governs interpretation of all subsequent provisions. Right? This is chapter 1. Okay. Next, coming to the chapter 2. Chapter 2, regulation of medical devices. Okay. Chapter 2 is regulation of medical device. Okay. We classify. First we define and then we classify. Right? Yeah. If you have anything, you can text here text in the comment box. Okay. Yeah. Then okay, coming to the chapter 2. So we classify here. So there are again 1, 2, 3, 4. Okay, 4 rules are there. Okay, here I mentioned 4 rules are there, 4 to 7. So 4 talks about classification of medical device. We classify medical device, and different provisions are different concepts are there. Okay, based upon the risk, based upon the surface, based upon the different parts, different classifications are there. I will tell that in the next video. Okay, how we classify medical devices. Okay. Then rule 5, medical device grouping, how we can group medical devices, and rule 6, essential principles for manufacturing of medical devices. Okay, so this is how rule 6 talks. And then rule 7, product standards for medical device. So this is classification, grouping, and essential principle for manufacturing and product standards for medical device. This chapter 2. Okay, so we classify, right? Next, coming to the chapter 3. So chapter 3 talks about authorities and officers and bodies. Okay, authorities and officers and bodies. So yeah. So this is the chapter 3 contains 12 rules. Okay, chapter 3 contains 12 rules, 8 to 19. Rule number 8 to 19. So what are the different rules? 12 rules present in this chapter 3. So they talks about authorities, officers, and bodies. So this establishes the regulatory infrastructure for medical device oversight. Regulatory infrastructure, especially. So rule number 14 talks about notified body. And rule number 15 talks about procedure to be adopted by notified body. 16 talks about fees to be charged by notified body. And 17 talks about suspension and cancellation of registration certificate of notified body. Then medical device testing officer and medical device officer. Rule 18 talks about both officers. Medical device testing officer, you are the person who will give you the test reports and everything, and the other thing is it's about you, right? So both people comes under rule 18. Okay, and rule 19, central medical device testing laboratory. It talks about laboratory, right? And rule 8, so 8 talks about licensing authorities. Okay, then 9 talks about delegation of powers of licensing authorities, and then controlling officer, then national accreditation body, then functions of national accreditation body, notified body. So this is how 12 rules are present in chapter 3. Okay, 12 rules are present in chapter 3. Don't worry, we'll make one at one place all these rules. Okay, I'll tell you that also. Just remember chapter wise. So chapter 3 contains 12 rules. Okay, then coming to the chapter 4. This is the biggest chapter. Okay, this is the biggest chapter in medical device rules. Okay, the largest chapter, right? So it contains 14 rules, 20 to 33. 14 rules, 20 to 33. So it's segregated into different categories. So these 20 to 14 rules are segregated into different categories. So 2021 talks about application process for manufacture of medical device. Chapter 4 talks about manufacture. Okay. Chapter 1 talks about define. define bodies. Okay, so definition, titles. Okay, and then chapter 2 talks about, yeah, come on, are you listening? Are you following? So chapter 2 talks about, I need replies so that is it visible? Is it clear? Okay, so we define, we classify. Excellent. Okay, we classify. Chapter 2 talks about classification, right? And grouping, right? Yes, excellent. Good. And chapter 3 talks about authorities and notified bodies and officers, right? And chapter 4 talks about manufacturing. Chapter 4, manufacturing. So define, classify, authorities, and then manufacturing, right? So in this application process 2021 and requirements and inspection, rule 22, requirements for grant of manufacturing license or loan license, and 23, grant of loan license for, this is class AB and this class CD. Okay, and then rule 24 talks about inspection report. And then the other category, so the third category in chapter 4, license grant and conditions. So maximum rules, maximum work, okay, maximum applications or licenses will be based upon chapter 4 only. Chapter 4 is the biggest chapter in medical device rules, right? So license grant and conditions. What are the license grant conditions? Rule 25 talks about grant of license or loan license to manufacture for sale or distribution, and 26 talks about conditions for manufacturing loan license. Okay, and then 27, change in any constitution. If anything change, right, about the employee, about any place or any manufacturing procedures, you have to intimate. Okay, that talks about rule 27. And then rule 28 talks about compliance and validity. Okay, validity and compliance. So rule 28, unannounced inspection by state licensing authority, and rule 29, validity of license. Okay, so you can inspect anytime, okay, without announcing. Certain inspections also can be done according to rule 28. And then test licenses. Rule 31, test license to manufacture for test, evaluation and clinical investigation. And rule 32, conditions of test license to manufacture for test, evaluation and clinical investigation. And rule number 33, cancellation of test license to manufacture for test, evaluation and clinical investigation. So this is the biggest chapter, chapter 4, and try to remember. Yeah, I will share this PDF in my mobile application. Don't worry. Okay, so please try to concentrate now in the live class. Okay. Yeah, so this is how chapter 4. Chapter 4 is the biggest. Chapter 4 is the biggest. Okay, next one, chapter 5. So import of medical device. Once we manufacture it in India, then according to the story I'm telling, so then we import. If we are unable to manufacture, then we can import from the other countries. So import. So chapter 5 talks about import of medical device. So chapter 5 talks about import of medical device. Again, in this, there are two categories. There are many categories, but just I divided into two. Number one is application. So rule 34 talks about application of grant of import license. We are just talking about import. Okay. Then 35 talks about inspection. Okay. So inspection, and then 36 talks about grant and validity. Rule 36 talks about grant of import license and validity of import license. 36, 37. Then compliance, right? Conditions to be compiled by license holder. Then 39, fresh application in case of change in constitution. So if you are changing anything, then fresh application need to be applied. So then this is normal import. Okay, normal import, normal devices, and there are some special import provisions are there. So that starts from rule 40. Special import, if it is directly imported by hospital, okay, or if it is directly imported by personal, okay, personal use. If you need anything, any medical device for personal use, you can directly import. You will get an import license for personal also. That is rule number 43. Okay, 42 and 43. Yeah. So we'll talk. So this is rule number 40, a test license for import for test, evaluation, clinical investigations. And rule number 41, grant of test license for import, test, evaluation for clinical investigations. These are the clinical investigations. And 42 import of investigational medical device by government hospital. 42 by government hospital. Okay. And then 43 by import of medical device for personal use. 43 is the personal use. So these are the special import provisions. These are normal import provisions and these are special import provisions. This will comes under chapter 5. Okay, chapter 5. Okay, right. Next, coming to the chapter 6. Okay, chapter 6. So once we manufacture or import, then we have to label properly. Okay, we have to label it. Okay, so what are the rules comes under this particular labeling of medical device? There are 5 rules. Okay, 5 rules. So rule number 44 talks about labeling of medical device. Rule number 45 talks about exemption of labeling requirements for export of medical device. Okay. The rule number 46 unique device identification of the medical device. The rule number 47 shelf life of a medical device. If it is do not have any expiry, okay, then it's fine. But if it have a expiry, then you have to write the shelf life of medical device. Then rule number 48 labeling of medical device are a new in vitro diagnostic IVD. Okay, rule a new in vitro diagnostic medical device for the purpose of test, evaluation, and clinical investigations. This is chapter 6, labeling of medical devices. Okay. Then, so we define, we classify, right? Then third one, what is the third one? Authorities, officers, notify body. Okay. Then fourth one, yeah, come on. Are you following? What is fourth one? Fourth one I'm talking. Yes. Fourth one. This is how you get confused. Okay. Right. Coming to the chapter 6. Okay. So fourth one is manufacture, fifth one is import, and sixth one is labeling. Okay. So remember that first slide story always. Okay. Then we'll go to the next slide. Chapter 7. Okay. So chapter 7 also contains 14 rules. Chapter 7 also contains 14 rules. So what is the other chapter which contains 14 rules? We discussed chapters. Which chapter contains 14 rules other than 7? Yes. Yes. Okay. Very good. देना चाहिए. ओके, एग्जाम तो दे दो, बाद में देखते. ओके, राइट. So next, so this contains 14 rules. So this talks about clinical investigation of medical device and clinical performance evaluation of new in vitro diagnostic medical device IVD. Okay, here performance. So once we manufacture or import after labeling, okay, then we have to go for the clinical investigation of medical device and clinical performance evaluation of new IVD. So here 14 rules again divided into two sides: investigation framework and oversight compliance. So this is for investigation and this is to observe by medical officer, medical device officer. So investigational framework. 49 talks about conduct of clinical investigation, how to conduct, and 50 talks about application of rule 122DD. So what is 122DD? We discussed in the previous videos. Okay. So part 6 of the DC Act. Okay. It is also have a provision to sell medical devices. According to the DC Act, if any manufacturer has a license before commencement of the rules. Okay. With proper conditions. Okay. With proper conditions required according to the medical device rules, no need to apply new. Okay, so we discussed, okay, DAB also, okay, DDB, okay, DD. So like this, how to remember this. This is especially sale other than homeopathic. Okay, other than homeopathic drugs, we can sell medical device or any drug, right? So this comes under 122D, that is rule number 50. Very, very important. And this connects DC Act. Okay, this connects DC Act, right? And then rule number 51, application for grant permission to conduct clinical investigation and permission to conduct clinical investigation. This is application and this is permission. And then rule 53, conditions for permission, and rule 54, suspension or cancellation of permission if anything goes wrong. And rule 55 talks about medical management and compensation related to the clinical investigation. So this is investigational framework. Then coming to the oversight compliance. So oversight compliance. So rule 56 talks about powers of search and seizure by drug inspector, by you. Okay, and then I think it is visible, right? Yeah. So powers of drug inspector. So this we can 56 talks about powers of search and seizure, and 57 talks about maintenance of record. So whether they are maintaining a record or not, then yes, the drug inspector should maintain the record. Okay. Disclosure of name, address, etc. of person involved in clinical investigation or clinical performance evaluation, right? And 59 talks about permission to conduct clinical performance evaluation for new IVD. 60 talks about conditions for permissions to conduct clinical performance evaluation, and last but not the least, suspension or cancellation of permission and medical management. So this whole chapter talks about clinical investigation of medical device and clinical performance evaluation of medical device. Okay, this is chapter 7. Chapter 7 is a big chapter because it contains 14 rules, and chapter 4 also big chapter, it contains 14 rules, right? Yeah. And among all, chapter 4 is the biggest one. Okay, chapter 4 is the biggest one because manufacturing, it talks about manufacturing. Okay. Yeah. Next chapter, that is 8. So chapter 8 talks about import or manufacture of medical device which does not have a predicate device. Okay, which does not have a predicate device. So in this again there are 3 rules are present. So chapter 8 contains 3 rules. Okay, chapter 8 contains 3 rules. Yeah, 3. So what is rule number 63? Permission to import or manufacture. So remember, predicate device. Okay, predicate device. So manufacture predicate medical device, and permission to import or manufacture new IVD. 64 talks about IVD, and this is talks about new device. Okay, new device, right? Medical device. This is in vitro. And then rule number 65, condition of permission to import or manufacture medical device which does not have its predicate device and new in vitro diagnostic medical device. So 63, 64 and 65. So this chapter address novel medical device without existing predicate devices, establishing special permission requirement for their import or manufacture. Import or manufacture. This is predicate. 8th talks about predicate devices. Next, coming to the 9th chapter. So yes, this is quite I want to make it June. Yes. So chapter 9 talks about duties of medical officer. Okay, duties of medical officer and duties of medical device testing officer. Your duties. Okay, those who are listening, your duties, because now it is very late time, but even though you are preparing, right? So duties of medical device officer. So what are the rules? Especially it contains 15 rules. तो अभी तक तो हमने जो भी चैप्टर्स देखा उसमें मैक्सिमम 14 रूल्स था. जो 14 रूल्स है 4th चैप्टर में एंड 7th चैप्टर में, राइट? इज इट करेक्ट? आर यू फॉलोइंग? You following? I need replace. कौन सा चैप्टर में 14 rules है? There are 2 chapters which contain 14 rules. What are those? I said one answer, that is 4th chapter. What is the other one? Right. Okay, 7th one. But so 4th is the bigger one Okay, even 7th is the bigger one, but number of rules are very high. Okay, rules number is very high in chapter number 9, even though it is smaller, but rules are the rules number is high. That is 15. Maximum rules are present in chapter number 9. Okay, so here what are the duties? So your duties will be explained in chapter number 9. So 9th chapter explains about duties. The rule number is 66 to 80. Okay, 66 to 80. So 66 to 69 is the DI testing officer duties, and 70 to 71 it is drug inspector duties. Okay, testing officer duties. 66 talks about duties of medical testing officer. 67 talks about test or evaluation of sample under subsection of 4, section 25 of the Act, and 68 talks about procedure to be adopted by medical device testing officer on receipt of sample procedures, and 69 talks about application for test or evaluation of medical device. Application for test or evaluation of medical device. This is testing officer duties. And coming to the medical device officer duties, rule number 70. Your rule is 70. Remember, okay. According to 70, you have to behave. Okay, wherever you want. Okay, unannounced visits you can do to the companies, manufacturing companies, according to the rule number 70, duties of medical device officer. And then 71, prohibition of disclosure of information. Yes, you can visit anywhere, anytime, but do not disclose the information. If you are visiting somebody's company, whatever the time, if something goes wrong in that company, okay, do not disclose the information until and unless there are 2 exceptions. If court is asking, you can tell that particular information, or some official business purpose. In these 2 conditions, you can disclose the information, but according to the rule number 71, you do not disclose any information, right? And rule number 76, purpose, and 78, dispatch. Okay, that linkage I will tell you later. Okay, so this is your duties comes under 70, 71. 70 is your duties. I will tell you that also in the next video, what are the main duties of the drug inspector in a shorter form. And then 71, prohibition of disclosure of information. And last, enforcement procedures. Yeah, so we'll move up. Yeah, medical device officer duties we have seen. And then the third one is enforcement procedures. So enforcement, how you go for enforcement? The rule number 72, form of order not to dispose of stock. So once something goes wrong in the medical manufacturing company, okay, with this particular device, do not dispose the stock according to the rule number 72. And rule number 73, if something goes wrong, and prohibition of sale, you can stop that particular product sale. And then rule number 74 talks about form of receipt for seized medical device, record, register, document, or any other medical objects. You can seize anything related to that particular medical device, maybe documentation or register or office, any device, okay, lying inside the office. Okay, you can take it, but after 15 days you must return it back. Okay, that comes later, right? So then 75, manner of certifying copies of seized documents. Okay, manner of certifying copies of seized documents. Okay, so this is about third enforcement procedure, right? So that first one talks about testing officer, second one talks about a medical device officer, third one talks about enforcement procedures, how you will behave with the stock. Okay, then the last one talks about sampling and disposal, how to disposal and how to sample. Okay, so sampling and disposal. So first, rule number 76. Okay, rule number 76, how you have to do sampling. Suppose you entered into the manufacturing company, okay, you must tell this particular information to the manufacturing people or company owner or any staff or sitting over there. What you have to tell the purpose for which samples have been taken. So according to rule number 76, you must inform the purpose, okay, why you are taking that sample and which sample has been taken, right? And rule number 77, form of receipt for samples for medical device where fair price standard is refused. So you can take the medical device, any medical device, okay, by informing, and at the same time when you are taking, you must offer tender price, fair price, Okay, so if they are rejecting that fair price, you can issue a receipt under 77 and you can give the receipt, right? If it is received, you can form of receipt for samples, whatever the samples you have taken. If they are refusing the fair price, you can give a receipt in form number 37. Okay, and rule 78, procedure to dispatch samples, and rule number 79, confiscation of medical device, and rule number 80, procedures of disposal of confiscated medical device. Okay, so this is the chapter 9th, right? So important. And coming to the chapter 10, so coming to the chapter 10, yes, again I have to zoom it. Yeah. So chapter 10 talks about registration of laboratory for carrying out test or evaluation. Okay. So medical device testing laboratory. So here different rules are there. So 81 talks about application. Okay. Chapter 10 contains 6 rules. So 81 talks about application for registration of medical device testing laboratory. 82 conditions of registration of medical device testing laboratory. 83 registration of medical device testing laboratory. 84 validity. Once you get the license, then what is the validity of registration? And then 85 talks about conditions of registration. Okay, 85 talks about conditions of registration. Okay, then 86 talks about suspension and cancellation of registration if something goes wrong, right? So 81 to 86 contains 6 rules. Chapter 10 contains 6 rules, and this chapter establishes the framework of registering and regulating the medical device testing laboratory. Chapter 10 talks about testing lab. Okay, chapter 10 yeah, I'll tell you how to remember. I have another slide, I'll tell you. Okay, don't worry. So chapter 10 talks about testing laboratory. Okay, chapter 9 talks about testing officer and medical device officer, drug inspector and testing officer. Okay, both people. Okay, so like that you just revise as many number of times as you want, then you will be remembering. Okay, yeah, this is how chapter 10 talks about 6 rules and it talks about testing laboratory. And then next chapter 11, chapter 11, right? So chapter 11 talks about sale. So we must remember the story. Okay, we define, classify. Okay, next, please, we define and classify. Come on, the story should be remembered always. Those who will tell, you will get good marks in the exam. Define, classify. Next what? Story yaad hai? No, not import. Import baad mein. You want me to show that story full time again? Forgot? 10th chapter आने तक पूरा okay. Yeah, क्या story क्या है? Okay, I'll show you the story. People are forgetting. So the story is very, very important. You must remember the story other than this. Okay. So here I'll show you the story by zooming. Remember this. Okay. First, we define and classify the medical device. Then we manufacture it in India or import. Okay, manufacture first, then import comes later. Okay, and before selling, we test it for clinically. Okay, clinical investigation, and then label it. Okay, label it properly, and then sell legally. Then goes for labs and inspectors. Okay, ensure the compliance. If violated, penalties follow. Then transition. Okay, please remember this story. Yeah, we'll go to the 10th chapter. 10th chapter talks about testing laboratory. Okay, then coming to the 11th chapter. 11th chapter talks about, yeah, sale of medical devices. Sale of medical devices. Rule number 87 talks about provisions for sale of medical device. 88 talks about supply of medical device to hospitals against delivery challan. Okay, कोई भी नया ऑफिशियल इनवॉइस बनाने का जरूरत नहीं है. If it is required for surgery, you can directly send from the manufacturing place or authorized agent to hospital without making GST bill on anything. Just make a delivery challan and cash or credit memos, CCM. Okay, I already explained all these things in the previous videos. Okay, directly send to the hospital by maintaining proper storage conditions. Okay, maintaining proper storage conditions. That is rule number 88 talks about. And rule number 89, if something goes wrong with the medical device, a recall of medical device. Okay, a recall of medical device. Recall must be initiated from the manufacturer only, not medical device officer, not notified bodies, none other than. If medical device officer found something fishy about that particular device, he cannot recall. Okay, he must command or he must inform the manufacturer. So some problem is occurred with this device, you initiate the recall. Okay, so the manufacturer must initiate the recall. So in the option, so many people kept wrong in the grand test too. Okay, so in the mock test one. So please make sure, don't get confused. Recall always initiated by the manufacturer only, right? So yes, that is rule number 89. So these three rules talks about sales of medical device, how we can sell. This is normal sale of medical device. This is the emergency sale of medical device. And this is if something goes wrong by in selling, after selling something goes wrong, you can recall. Okay, manufacturer can recall. Okay, so this is how you remember chapter 11. Okay, chapter 11. Then coming to the chapter 12, last chapter, it contains miscellaneous. It contains 8 rules. Okay, it contains 8 rules. Final provisions for covering exemptions, exports, and administrative procedures. So we transition. Okay, we talked about transition, and before last is penalties. Okay, if something goes wrong, then penalties. Then this is transition. Okay, final rule provision covering exemption, exports, and administrative procedures. So what are the rules in exemption and export? Rule number 90. Exemption from provisions related to the medical device. What are the exemptions? Okay, exempted medical devices, right? And then rule number 91, export of medical device. Export of medical device. अभी तक इंडिया में बनाया, नहीं तो इंपोर्ट किया, ये सब हो गया. मगर अभी 90 से 91 से we can export them, we can make and we can assemble in India. You can send back to other countries. That is export, and export करने के लिए आपको कुछ licenses चाहिए. Okay, there are 2 licenses. Okay, right, free sale certificate, right? What is the other certificate? Okay, right. So yeah, there are this is how export and exemption. 91 talks about export, and then the other category is administrative procedures. Rule number 92, rejection of application. If something goes wrong, then you can reject the application. And then 93, debarment of applicant. Debarment of applicant. If applicant is not following the rules, or if he is misbehaving or not supporting for the inspection or other thing, debarment of applicant you can do. That is administrative procedures. Then coming to the operational provisions, 94, mode of payment of fee. Okay, 94, mode of payment of fee. 95, digitalization of form. So recently the CDSUO started compulsory digitalization of forms. Okay, so completely the form should be available in online. The applicant should go to the online, and then he should apply through the online, and the medical device officer also give the whatever the insights again online, and the higher authority CLA also, they will check in the online only. So this made the everyone life easy. Manufacturer life, drug inspector life, and CLA, central licensing authority, that is DCGI office life also become easy. So with this digitalization. And the last one, final provisions, overriding effect and savings. So 96 is overriding effect. I always tell you, remember this, DC Act is a supreme. This medical device rules are secondary. Okay, DC Act is supreme. According to the DC Act only everything will go. Okay, but if something is missing in the DC Act 1945, then this have overriding effect. Okay, overriding effect according to the rule 96. Okay, then they can change, they can modify any rule. Okay, not act, rule. The last one, savings. Okay, 97 is savings. This is how chapters then rules are there. Okay, chapters then rules. I hope you remembered. So एक ही बार में नया आएगा. So you just repeat listening this video, or you just note it down somewhere, and you have to revise many times. Then you will get clear idea. Okay. Yeah. Next. So this is the summary slide. Just remember, this is very important slide. So you will not get confused about the rules. So this is, it contains 12 chapters, medical device rules. It contains 12 chapters and then 97 rules. Okay, 97 rules, and the largest chapter is fourth chapters. Okay, largest chapter is fourth chapter, which contain 14 rules only. Okay, don't get confused. 15 rules are present in one chapter. That is not the largest chapter. Which chapter contains 15 rules? Can you pose your answers? Which chapter contains 15 rules? Come on. If you tell this answer, you will get good marks. Which chapter contains 15 rules? 14 rules, fourth chapter? No. Yeah, chapter number. 15 rules containing chapter. Even though it is not biggest, but number of rules are very high. Okay, very good. Okay, good. So largest chapter is fourth chapter, which talks about manufacturing. Okay, and seventh chapter talks about clinical investigation. These two contain 14 rules. Okay, fourth and seventh. These are the largest chapters, and this talks about, fourth talks about manufacturing, and this talks about clinical investigation. Seventh one talks about clinical investigation, right? And key regulatory areas: manufacturing and import. 24 rules governing the production and the importation. Okay, so 24 rules are important for the production and importation, and then 14 rules are very important for the clinical investigation, safe testing and evaluation. 14 rules. Okay, then enforcement and compliance, 21 rules are there for officers and testing and oversight. Okay, for officers there are 21 rules are there. Okay, so 21 rules are there for the officers. Then this medical device 2017 established a robust regulatory framework that balances innovation with patient safety, ensuring medical devices meet international standards while facilitating access to equality healthcare technology. So this is what the medical device rules 2017. So just it's all about digits, how you are remembering the digits. Okay, it's chapters, rules and forms. Okay, yeah, right. So this is about chapters and rules. Okay, yeah, I'll share the PDF, don't worry. So I hope you are joined in the WhatsApp group. I'll share in the WhatsApp group. Okay, in the below description there is a WhatsApp group link is there, you can join in that. So we are sharing all the valuable information in that. Okay, don't worry. Okay, so this is about chapters and rules. So do you want us do you want me to tell about forms also? Do you want to discuss now, or we'll discuss in next video? Forms, how to remember the forms at a time. What is 9? Somebody's okay. So yeah, let's. I thought it is late night. You are feeling bored, but you are interested. So let us talk about forms also. Okay. Yeah. Right. So I have divided these forms into again different categories. Okay. So there are different categories. I'll tell you. First, I'll tell the categories. Then I will go one by one. Right. Yeah. So 1 to 42 forms are there. Okay. 1 to 42. So in the medical device rules 2017, it stopped at 40 only. But again, there are two rules are present, 41 and 42. So that also we'll talk. Yeah. So these 42 rules are divided into different category. Okay. So yeah. The MD1, okay, these are the forms we talk in the abbreviation MD, medical device form number 1. MD1 to MD10, core manufacturing license, okay, core manufacturing license. And then the second category, import and special purpose forms, okay, import and special purpose forms. And then third one talks about the clinical investigation and special permission forms, okay, clinical investigation and special permission forms, that is number 22 to 29. Okay, then fourth one, sampling and testing forms, okay, sampling and testing forms, MD 30 to 38. And then fifth category, supporting infrastructure forms, MD 39 to 42. Okay, supporting infrastructure forms, MD 39 to 42. It talks about testing laboratory and retail sale license. Okay. So here MD 1 to 10. So MD 1 to 10. So this is talks about core manufacturing license. MD 1 to 7. Okay. MD 1 to 6 first. 1 to 6 talks about A and B. Okay. Lower risk. Okay. 1 to 6 talks about A and B. Then 7 to 10 talks about C and D. Okay. 7 to 10 talks about C and D. Okay, so there is a classification of devices. So that is in separate slide. Okay, I'll show in the next video. Yeah, so this is 1 to 6 AB and this is 7 to 10 is CD. Okay, C and D devices manufacturing license. Okay, then import from 14 to 17 talks about import license forms. Okay, and then 18 to 21 talks about special import forms. Special import forms we have studied in the chapters. Okay, there are certain provisions directly imported by hospital, directly imported by personal use. Okay, direct import by the companies. Okay, there are different categories, right? So that's how special import forms are there. In special import rules also there. Okay, and then clinical investigation form number 22 to 29. So clinical investigation, clinical performance, and no predicate and new IVD device. Okay, clinical investigation, clinical performance. Based upon this, there is one chapter also. What is the chapter name? Which is especially focus on clinical investigation or clinical performance of medical device. What is the chapter? Which chapter? So you have to correlate like this. Okay, you have to correlate like this. Okay, and then third category, sampling and testing. So in this, sample memorandum, test results, test reports, test application. Sample memorandum 30 and sample test results, medical device testing officer. Okay, the testing officer will give results in 31, and that should contain reports also. Whatever the methods he used, that report should be submitted in triplicate copies. That is some form number 32, and they can apply the test application form number 33. 30, 31, 32, 33. Okay, here the forms. Okay, this up to here 33, right? And then sampling and dispatch. Okay, sampling and dispatch. 38 talks about dispatch. Anyway, that we'll talk later. But overall view of forms you will discuss here. Then supporting infrastructure, testing laboratory, and retail sale. So, okay, retail sale of medical device. We'll talk about 41 and 42. Okay, and how to remember this? I'll tell you individual now. So this is the overall story, right? So core manufacturing, import, clinical investigation, sampling and testing, and supporting infrastructure. Now we will go one by one. Okay, so now first core manufacturing. Okay, so in this core manufacturing, first we are talking about A and B, low risk. Okay, first almost safe. Okay, A for almost safe. Okay, B for basic risk, C for critical, D for danger. Okay, so the first six forms talks about this particular A and B. Okay, so A and B, so notified body's registration. Okay, and then two, certificate. Once they apply notified body, then they will get the certificate. And then 3 and 4, application of manufacturing license. So this is 3 and 5. Okay, 3 and 5 talks about manufacturing. Okay, 3 and 5 talks about manufacturing, and 4 and 6 talks about loan license. Okay, this is 3 and 5 talks about manufacturing, and this is 4 and 6 talks about loan license, right? And this is A B. Okay, A B, right? So yeah, next we'll talk about, yeah, this is 3 4 5 6. Next we'll go to the higher risk. Yeah, here 7 8 9 10. Okay, 7 8 9 10. So 7 is the application for manufacturing. Okay, 8 you will get the license, and then 9 manufacturing of CD. Okay, so this is, and you will get the certificated loan license, right? So this is how 7 8 9 10. So 1 to 10 talks about core manufacturing, and you can remember this is the okay, you can remember this. Okay, so here, so 1 2 talks about notified body, application and certificate. They will get the certificate. And then 3 and 5 talks about manufacture of AB. Okay, manufacture of A and B. And 4 6 talks about loan license. Okay, loan license. So 1 to 6 will be A and B only. 1 to 6 talks about lower risk devices, A and B. Okay, and then coming to the 7 to 10. In 7 to 10, 7 9. 7 is the application and 9 is the certificate. This is the application, this is the certificate. This is the application, this is the certificate. Okay, loan. This is manufacturing and this is loan license. Okay, and this is manufacturing, this is loan license. So 8 is the application, 10th is the certificate. Okay, and 1 to 6 talks about A and B, and 7 to 10 talks about C and D. These are the dangerous devices. Okay, so C critically concerned, and D is almost dangerous. Okay, like heart valves, stents, cardiac stents. Okay, so in that way you remember 1 to 10 forms. Okay, 1 to 10 forms. 1 to 6 talks about A, B, and 7 to 10 talks about C, D. Okay, and in that again two classifications. One is for manufacturing. Another one is loan license. Okay, so this is how you remember easily 1 to 10 forms. Okay, next slide. Yeah, so we completed core manufacturing forms. Okay, core forms which are related for manufacturing. Then we will talk about import and special purpose forms, MD 14 to MD 21. Again, MD 14 to 17 is the normal import, and 18 to 21 is the special purpose. That's what we are discussing. Okay, importing by a hospital, importing by the personnel. Okay, so in that way, so special import forms are there, 18 to 21. But 14 to 21 talks about import. Under that, there are again two separate categories. So 14 to 17 talks about only import of medical devices. So 14 is the application and 15 is the certificate, right? So import of medical device, and 16 is the import for clinical test. This is the application to perform the clinical test, and 17 you will get the certificate, grant of license. So this is how 14 to 17 talks about import of medical devices. One is for the import and the other two is for the clinical investigation, right? And then special import forms. So 18 for the application of government import. Okay, MD 18. Okay, Gandhi Hospital, suppose example, AIMS Hospital from Delhi. So if they want to import any medical device from America, they can directly import by filling the form that is MD 18. Okay, directly they can import, right? And then certificate they will get MD 19. And then personal use. If I want any medical device for my personal purpose. Okay, so we are planning to design a medical device. okay, which is automatically pricking the insulin. So I gave one presentation to the government, what is like CCMB. So I am planning to make a medical device. So right now some of the medical devices are available in the market. So the smartwatch detect the glucose levels. Okay, smartwatch detect the glucose levels, and patient will get the alarm. Then the person will take the insulin pens. You know that market is available. So he will take the insulin pen and prick self-prickable. Okay, will self-prick the insulin. So that is available right now, the technology. But what my proposal is, so yes, one smartwatch will be tied to the hand, and then another medical device will be tied to the body anywhere. Okay, then there will be a AI integration. So we are going to integrate AI with medical device and the device which is containing insulin loaded already. Okay, so when the blood glucose levels are increasing, right? Then this device will get the information, and that will prick the insulin directly upon calculating the levels of glucose. Okay, what is the normal glucose levels? What is the normal glucose levels? One of my student answering what is the normal glucose levels means 120/80. Is good student only, but confusing. What is 120/80? What is normal glucose levels? What are the normal glucose levels? Range of blood glucose. Come on, I need answers. And what are the units for blood glucose levels? Right, units. I need units. Yeah, somebody correct answer. What are the units? Mg per deciliter. Excellent. Okay. Yeah. So right now the human active pens, insulin pens are which are available in the market. So they will self-prickable. Okay. So once they prick, the metered dose will go. The exact dose, whichever they assigned, that the dose will go. But here the problem is that much dose is not required because the insulin is only 135, but the dose is decided based upon the 150 diabetic patient. Okay, so 136 assume. So whatever the device which we are going to create, it will calculate the insulin dose by exact glucose levels. 136, how much insulin is required, that much only it will prick. Unnecessarily, no need to take the extra insulin. Okay, so this is how the new diagnostic device we are going to propose. Let's see if you become a drug inspector. If my idea will work out, then please give me permission. Okay, I hope you will give that permission, right? Okay, so this is how, if the hospital want to purchase any medical device from foreign, directly they can purchase by applying MD 18, and they can get the license by MD 19. If I want, suppose I'm doing research on this particular medical device. So in America, one instrument is there already. So I want to bring it down into the India. So then I can directly apply to the CDSCO to import. That is the form number MD20. Then I'll get the license in MD21. Okay. So this is personal use import, right? PU, GH and PU. So here I have given some mnemonics. Please try to concentrate. Import, ICT. Just remember this ICT. Okay. CT for clinical test. CT for clinical test, and first one is import. So this talks about 14 and 15, and then 16 and 17. Okay. So this is how remember these particular forms. And coming to the special import, GH, government hospital, 18 GH. Okay. 18, 19, and PU for personal use, 19, 20, 20, 21 personal use, 18, 19 GH, government hospital. Okay. Government hospital. So this is how you remember form MD14 to MD21. Okay, MD14 to MD21. Right. Next, clinical investigation of special permission forms. Clinical investigation. Import ho gaya, core manufacturing completed, import completed. Right now, we'll go for the once import, we'll go for the clinical investigation and special forms, special permission forms. MD22 to 29. So here we'll see what are these forms. MD22 talks about application for clinical investigation, and you will get the certificate in 23. Then MD24 talks about clinical performance, that is for devices. Okay, 24 for device, in vitro diagnostic devices. Okay, that is for MD24, and you will get the license in 25. And then 26, 27. 26 is about no predicate device, and you will get the license in 27. And 28 talks about new IVD device, okay, which is not present in the market, and you will get the license in 29. Okay, this is about clinical investigation and special formations. So I've created some some mnemonics here. So CI, okay, clinical investigation, CI, CP, and NP, okay, NI, okay, new in vitro diagnostics. So clinical investigation, okay, clinical performance, because it is a IVD, okay, clinical performance. Then NB, okay, NP, no predicate device. Then new in vitro diagnostics, clinical data must be validated. Okay, so this is how MD 22 to 29 always talks about clinical investigation and special permissions. Okay, next, coming to the sampling and testing and supporting infrastructure. Okay, supporting infrastructure forms. Again, this divided into two categories. 30 to 38 talks about sampling testing forms, and then 39 to 42 talks about supporting infrastructure. These are the 42 forms story. So here, so sampling and testing forms. How you will do the sampling? So based upon form 30, MD 30, document. It is a document. You must maintain, you must write a document which talks about memorandum of sample. Memorandum of sample contains date, device name, and the particular serial number of the device. Okay, that is the document. It should contain memorandum for samples. Then the testing officer test results will give in 31. Okay, this is 30. Then 32 test reports. 3 copies of test report should be submitted. What are the protocols they used? Testing officer used, whether it is international standard protocols or what. Okay, they have to submit in a separate copy. Okay, separate packet. Okay, that is 32. And then application 33, test purchase application. If testing officer, okay, or purchaser, right? So if you want to apply for any test, okay, new test, then they can go for the application. This is application. So in from form 30 to 38, all are documents. Only 33 is the application. Only 33 is the application. Okay, till now we talked about application certificate. But in this sampling and testing forms, only one application is there. That is MD33. Okay, and sample 38 is the dispatch. Okay, and 36 talks about sampling purpose. Okay, 76 rules talks about purpose. Okay, and here 36 talks about purpose of the sampling. Why you are doing the why you are making collecting the sample. Okay, that particular device. Okay, yeah, this is about sampling. And 38 dispatch memorandum. Okay, you have to dispatch the memorandum of samples and device in separate packets with the same seal. Okay, to make sure that it is not damaged or it is not misinterpreted. Okay, that is very important. So this is sampling. Okay, sampling and testing forms 30 to 38, and then supporting infrastructures 39 to 42. So 39 is the application for testing laboratory. If someone wants to start this testing laboratory, the application should be made in application 39, form 39, and then they will get the license in 40. Okay, they will get the license in 40. And what about 41 and 42? It is a retail sale of medical device. Okay, 41. Yeah, so yeah, it is down. So retail sale of medical device application in 41, and in 42 they will get the license to retail sale of medical devices. Okay, so this is how 1 to 42 forms should be remembered. Okay, 1 to 42 forms should be remembered. This is a summary of all forms. So core manufacturing forms, and then import forms, and then clinical investigation forms, sample testing forms, and then supporting infrastructure forms 39 to 42. Okay, so this is how you have to remember the forms. Okay, so with this I hope you enjoyed the video, right? So please, if you enjoy the video, please subscribe our channel and share with your friends. Okay, share with your friends and do like our videos and to go through the videos also. And tomorrow morning we are going to conduct one open mock test for national level. Okay, so 6 a.m. to 10 a.m. test will be conducted, and 10 a.m. to 2 p.m. live discussion will be there by all subject expert, different subject expert. Okay, so do write that mock test. Okay, this is mock test 2, and in the description we have given test series. Okay, we have already started test series 1 week back, which contains almost 40 tests. Okay, really, if you want to practice all those tests, so the description, purchase description is already given in the link. Only 500 rupees for that. So you can go through almost 40 tests are there, including 5 grand tests and 2 mock tests. Okay, and you can get this mock grand test, 2 grand test paper discussion, and this mock test paper discussion, and another mock test paper discussion also. Okay, so yeah, I will share the WhatsApp group link here. Okay, so you can join in the description. Other videos also there are description. The WhatsApp link is provided. You can join over there. I will share here also, right? And you can, if you want to practice all our questions, you can purchase it 500 rupees only. Okay, the link is given in below, and you can download our mobile application. It is available in the mobile app also. Dr. Dineshpharma in Play Store. It is available in the Android for and iOS also. Dr. Dineshpharma Play Store. Yes, that is test series. Yeah, and in the next video I'll try to make another video about the classification of devices based upon the risk, based upon the duration, based upon the surface area, based upon different categories are there. How to remember that all those devices and examples for different classifications. Okay, so that I'll make in the next video. Do follow the channel and continuously. Then I will post the link in the WhatsApp group whenever I do the video, because we do not have much time. So that's why I'm making improper timings, excuses. Okay, in the morning I have to do, but some other occupied in other meetings. So that's why I try to do this time. Okay, so please follow our WhatsApp group and channel for the updates, right? Yeah, someone is asking, sir, what is your qualification, right? And many people call. So I'm Dr. Dinesh. I completed my PG PhD from Naipur Mohali and currently working as a research scientist. Okay, and I'm training students from last 15 years. Till now, almost 28 students have become drug inspectors in Telangana and CDSCO, and many students working as a pharmacist in different organizations across the India, and almost thousands of students joined in Naipur by the training of our faculty and our institution. Okay, so please share this information to your college friends also, college students, those who are currently pursuing, and they will get a benefit for the GPAT. Okay, GPAT and pharmacists and yeah, where the test will be conducted in the mobile application. Okay, mobile application, Dr. Dineshpharma. You download our mobile application. Yeah, I'll share this video in the WhatsApp group. Please join our WhatsApp group. I'll share there because I cannot share here. I don't know. So I'll make these PDFs available for all. No need to worry. Any questions from today's session? This video, any questions you can ask. I'll try to answer. Are you enjoying the videos? Yes, yes. Okay, thank you. Thank you for your feedback. Okay, so we'll stop here, and I will see you in the next video. Okay, about classification of medical devices and how to remember different interrelation between the forms like 30, 31, 32, 33. Okay, 71, 70, 71, 76, 78. Okay, 70 is the duties. Okay, 71 don't disclose the information. 76 what is the purpose. Okay, and 78 you have to dispatch the how to dispatch the samples. Okay, in this way there are certain forms, and we will discuss the interlink between the forms. So do comment your feedback in the comment section. Okay. So after once you complete this video, and thank you for watching us. And thank you for subscription also. Okay, so many students subscribed in last 2 days, and we are reaching out students. We are very happy. Sale prohibited. I don't know. Sonali, I think. Yeah, Sonali. Talking about sale prohibited. What is your question actually? What? Test series sale is prohibited or what? You are talking about that? Yeah, okay. So we'll see you in the next video. Thank you for watching us. If you need any help, so I will post my WhatsApp group link here. So you can join over there. Yeah, this is WhatsApp group link. You can join. Yeah, if you need any further information, you can call to these numbers. Yes. Yeah, maximum questions expected from medical device is 50. Okay, we are expecting 50. Already I gave in previous video I made that. Okay, there are 6 sections, and each section I have proposed marks also, expected marks I have given. Please go through that video, and you can call to these numbers if you need any further assistance. Yeah, thank you for watching. We'll see you in the next video.